The postnatal period is from delivery until 6 weeks after the birth. Some complications that can occur during the postnatal period may include some of the following: the baby blues or postnatal depression. The baby blues usually occurs on day 3 or day 4. You can find yourself becoming more tearful. We would advise that if these feelings persist for longer than 2 weeks, to attend your GP. Breastfeeding problems can also occur, such as an infection of the breast called mastitis. If your breast becomes red, hot or inflamed and you get a fever, this might be due to an infection and may need treatment by antibiotics. And it's important to attend your GP or the hospital for a review. Bleeding can also occur, and most bleeding will happen immediately after delivery. However, some can occur more than 24 hours after the birth. This can be from an infection or some retained tissue such as a placenta membrane. It's important, if you are bleeding heavy or passing large clots or soaking more than 1 pad per hour, to attend our emergency department for further investigations. Perineal infections can occur. This is after often an episiotomy, or if women have a small tear that needs stitches. There's a risk that these stitches can become infected, so it's very important to keep an eye on your stitches. If you notice that you have a lot of pain or are worried about an infection or breakdown of your stitches, do attend your GP or again attend the hospital for a review. We would also advise taking regular paracetamol and ibuprofen for analgesia in the first few days. It's good to keep the area nice and clean and dry, and sometimes if you can let the air at the area, this can be very good to help with the healing process. It's also important not to put anything in the vagina, such as tampons, for 6 weeks to help with the healing. After a Caesarean section, it's also very important to keep an eye on your wound and the stitches, again looking for signs of infection like redness, tenderness or ooze. And if you're worried at all about infection, to attend your GP. Women can also sometimes get a urinary tract infection after delivery, and this might present with pain when you're passing urine or urinary frequency, and it's good to attend your GP, as you may need antibiotics for treatments. If you notice that you have any incontinence that's persisting after delivery, it would be important to attend a women's physiotherapy or your GP. Blood clots can also sometimes occur after delivery, and women are at an increased risk of blood clots after the postnatal, in the postnatal period, or after they have a Caesarean section. Another thing to note after a Caesarean section is that you shouldn't drive for 6 weeks, as you use your abdominal muscles to brake, and you should avoid lifting any heavy items. Important to talk about contraception after you have a baby. So after a Caesarean section, we would probably advise waiting about 18 months before your next pregnancy to give everything a chance to heal. The progesterone only pill is recommended, and this can be commenced straight away. It's important to try take it at the same time every day, and you can take it back to back without any pill-free period. Other forms of progesterone only include the Mirena coil, which lasts up to 5 years, or the Implanon, which is a little bar in your arm, and that can last up to 3 years. The combined oral contraception pill is not really recommended to women after they give birth, because it can increase your risk of getting a blood clot, and also it can reduce your breast milk supply if you're breastfeeding. And your midwife can discuss all this with you before you're discharged from the hospital. Thank you for your time.